Welcome to Aligning Funding Opportunities and Initiatives in California, Funding to Prevent Homelessness Learning Exchange session with Althea Lyness-Fernandez, a housing specialist from the Housing and Homelessness Branch from the California Department of Social Services, and Elena Fiallo, the Managing Operations Director at Population Change Institute. So we're very honored and fortunate to have them here today to really kind of have a deeper conversation around how housing and some of these housing initiatives can help us really think about how they can help support families and prevent child abuse. So just a few reminders. I know we're all Zoom experts by now. There we go. I just wanted to bring a few things to your attention. So if you needed to mute or unmute yourself, this is going to be a discussion today. So we really want to be able to interact with each other. So if you had a question or comment during some of our discussion time, you can unmute and mute yourself with a little microphone, as well as share your camera. So you can do that if you feel comfortable. We enjoy seeing who we're talking to, but of course, sometimes we are not ready to do that. So feel free to do it. It feels comfortable to you. If you have a question or comment and you wanted just to directly chat us, or if there was a technical issue, you can use the chat to do that. Or if you just wanted to make a comment during the time that our facilitators are sharing information, feel free to use that, or the reactions. They've really expanded the reactions, so it's really nice because they have different ones that you can use now. So feel free to use those as well. So the Strategies Technical Assistance team here with you today is myself, Lydia Marquez. I'll be here to help facilitate this process, this learning exchange session. And Anvi Din, who's our amazing events coordinator, will also be here to help if there's any issues that you may have with technical assistance. So again, I will hand it over to Althea and Elena, who will help facilitate a discussion around some of the housing initiatives that they talked about in their previous webinar, and kind of give us a little bit of a recap in case we needed it. So I will hand it over to them.
Great, thank you, Lydia. Good morning. I think you guys are still in morning. I've already moved into afternoon, but welcome. Thank you for joining us. Just to start out with, I was wondering if I could invite everyone to put your name and the community that you're here representing, and just let us know whether, if you were able to catch last week's session, kind of what stood out to you the most, like what stayed with you over this week, what stood out to you as far as the presentation. And if you weren't able to catch last week's session, just go ahead and put that in the chat as well, that that you weren't able to catch that last week, and we'll kind of adjust our recap today to bring you along for the ride. Thanks, Janelle. Okay, Janelle wasn't here last week. Wonderful. We are glad to have you here too, Janelle. Thank you. And what community are you with, Janelle?
Hi, good morning, everyone. I'm Janelle. I actually am here in Ventura County. I work for an organization, Kids and Families Together.
Oh, great. Thank you. Welcome.
Yes, thank you for having me.
And what about everyone else? Are you able to enter in the chat the community that you're representing, and then anything that stuck out to you from the last session, or if you were not able to join us last session, let us know that as well. All right, and feel free to unmute. Oh, there we go. Hi, Adam.
Hello.
Great. Thank you. Yeah, go ahead and speak, Adam. That's fine. You feel free to unmute yourself and talk. We're a small group, so.
Yeah, no, I used to do it in the chat, so I was doing that. It was good to see you again. Yeah, it was very informative. I'm definitely on the learning end of the learning exchange, and looking forward to kind of hearing how people are incorporating this. So, thanks.
Great, thank you. All right, and anyone else? A few folks just joining us. We were just asking folks to put their name and community that they're here representing in the chat, and then anything that stood out to you from last week's session. And if you weren't able to make last week's session, let us know that as well so we can adjust our recap. Thanks, Marlo. Great, yeah, there's a lot of resources coming down the pipeline. Oh, hi, Sarah, welcome back. I know you were here last week from Butte County, welcome. Okay, well, keep typing away and I'm gonna hand it off to Althea. And Althea will just do a brief recap of what we discussed last week, just to get everybody into the space and to catch everyone up that wasn't able to attend. And then we would like to kind of open it up for discussion, to talk about some of the ideas and sparks that are coming to your mind as we kind of talk about the opportunities that are available. Thanks, Althea.
Thanks, Lena, and good morning, everyone. It's great to see those of you again who were able to attend last week, and also excited for some fresh perspectives and to have this chance to debrief a little bit after the information has had about a week or so to percolate a little bit. So looking forward to this conversation. I will do a really brief recap of what we discussed. We went into quite a bit of depth, so I will not go into those details now, but more remind you all of some of the key ideas and programs that we discussed. So again, my name is Althea. I'm a policy specialist in the California Department of Social Services in our Housing and Homelessness branch. And there are several state agencies that manage and oversee funds for housing and homelessness. So we are one of about 3, although there's many other state agencies that contribute to the overall system of care. But the California Department of Social Services, we sit more at the intersection of, in our branch in particular, housing and homelessness programs that intersect with the social service, either a specific program or the social service safety net. And so I talked a little bit about some of the programs that we manage. We manage several, including some that are geared more towards children and families, as well as some that are geared a little bit more towards individuals, seniors, people with disabilities, although some of them serve families as well. And I went into depth into especially 2 of our programs, Bringing Families Home and the Housing Support Program. So as a reminder, the Bringing Families Home program serves families involved in the child welfare system who are homeless or at risk of homelessness. And the Housing Support Program provides support for families who are involved in CalWORKs, who are homeless or at risk of homelessness. And again, we do have other programs that can serve families, but these are more of the touchstone family programs. And these programs provide a variety of services, and they're meant to be flexible to meet the particular needs of a family. And so this can include housing related case management, housing stabilization services. It could be things like credit repair, home modifications to make a home more accessible. And a key part as well is direct housing related financial assistance. So rental assistance, rent back pay, security deposits, moving costs, just anything that a family really needs to either find new housing, maintain their current housing, or stabilize in new housing. And all of our programs, including these 2 family programs, are currently part of a tremendous expansion in funding for housing and homelessness across the state. And because of that, we have additional one-time funds available this fiscal year, and the money is available for expenditure for about 3 years, and the same amount expected next year. available for not only current grantees with these programs to expand to serve new families, but also for new grantees to establish these programs as well, especially for bringing families home, which is, you know, I think all but to implement HSP, and we're hoping to expand BFH. I think currently there are around 30 grantees or so. So that's the 101 on the programs that we highlighted. And then I also spent some time talking about prevention in particular. As I mentioned, in these programs, they are eligible to serve families who are at risk of homelessness. But this is new to for BFH and HSP as of this fiscal year due to some changes in legislation and made more possible by the expansion in funding. And so I talked about some of the key principles that we're thinking as we develop prevention guidance for communities, but also want to frame it and pose it as an area for discussion as well. When we talk about, we're coming from I'm coming from a place where really we're talking about homelessness prevention, but I know that a lot of you are also from the lens of child abuse prevention. And so thinking about how those two frames to support children and family well-being, can intersect a little bit more. And then finally, I talked about some cross-program priorities and principles that we apply to all of our programs, such as incorporating racial equity, the concept of housing first, which means that you should connect people to housing without preconditions. You don't wait for housing readiness. And things like working with tribal governments and establishing programs. Again, that's for BFH, we have a tribal government set aside that we're working on issuing a letter for. So it was, and we had some Q&A, which was really great, and hope that we'll be able to do some more of that now. Oh, and a key piece that I left out was that the expanded funding for this fiscal year, we issue those through funding letters, and we hope to have HSP and BFH out very, very soon. HSP will probably come first and then BFH. So, this is a great time to be talking at the local level with your community partners, since these programs are implemented. The funding is issued to county departments of social services, and often they work in partnership with others. But since the funding is imminent and about to be out, this is the right time to have some of these conversations. So I think that pretty much covers our recap. Elena, is there anything else that you want to recap before we open the floor to some Q&A?
No, I think you covered it very well. And yeah, I want to open it up to initial questions that folks sort of were able to marinate on as after last week's session. I know you have so many other priorities, you may not have thought about it again, but just in case you have, just any initial questions from you. And then we want to kind of have, larger group discussion where we might have some questions for you. And please feel free to unmute yourself to ask questions. We're a small group, so we can be a little less formal.
Hi guys, it's Janelle. I wasn't here last week, but I am very intrigued in this topic. And I know I'm kind of familiar with the Bringing Families Home program. There was a second one that you mentioned, housing support programs. I might have misnamed that, but are there any programs that, or let me back up. Those two programs, I'm assuming, must be referred from like a social worker or from somebody. Are there any programs out there that don't have to have a direct referral?
Yeah, so each of our programs, or these two programs that I mentioned, do have a tie into the social services safety net. So either CalWORKs or child welfare, it is very common, and I think I would say probably most common, to get a referral from a child welfare caseworker or a CalWORKs caseworker. But, and this is more common in the housing support program around CalWORKs, that's not the only way that people can be referred to the programs as well. We do require that all of our programs collaborate with the local homelessness continuum of care. This is actually something we talked about last time, because I know that there are several continuums of care. So these, the homelessness continuum of care is like a local, sometimes county specific, sometimes regional planning body that manages housing and homelessness programs. And so we see, and it depends on like at the kind of county level, but we see some programs as well work with the COC to get referrals. And so, for example, if someone goes to the COC, or if a person is searching or is looking for housing and homelessness assistance, and they mention that they're in CalWORKs, that could be kind of a referral point into the program, even if it didn't necessarily come as like a direct referral from the social worker, if that makes sense. So it's not really part of our program designed to require like a internal direct referral. There are kind of different entry points as well. And really it's more about meeting like the eligibility criteria. So it's my first thought in hearing your question. And Elena, yeah, if you have any additional thoughts, or Janelle, if there's like any clarifying information that you want to provide.
Is there somewhere, I don't want to take the meeting, but is there somewhere that maybe I could look, or maybe you guys could send me an email? I'm very interested in what qualifies a person. I've directly sent many of the families that I work with the Bringing Families Home program, and I've seen them do amazing work. But sometimes I don't actually know what would qualify a person or not. Is there somewhere where it says that, or I could look at that for each of these programs?
Yes, definitely. So each of our, I'll link to the website. Of course, with eligibility, sometimes there's like quite a bit of nuance. So where we really go into depth in this is our funding letters, where we sometimes issue, depending on what's new in that fiscal year, where we issue updated guidance. And for BFH in particular, I will say that because the new funding letter is not quite out yet, and we did have updates to eligibility, that what's on the current website right now probably won't go as it won't cover everything that's new quite yet. But that's a good start. And then when we issue the new funding letter, that can really go into the nuance of like what might make somebody eligible. But I think also, the BFH programs and HSP as well have someone on their end that whose job it is, of course, is to take someone who might be eligible and to run that past the more like in-depth eligibility criteria. And so I would say like that's part of why it's so important to be in conversation and in communication with the local, BFH or HSP operators, because you can get like a 70% understanding of what might make someone eligible, and they can worry about the like signing the real
Absolutely.
more details. So I think it sounds like you already might have some of those referrals, but would just say, where you all can share information on what would make it easier for them, what would make it easier for you, and how they operationalize our general eligibility, because communities can also kind of, communities have discretion to shape their program as well. So that would be like my suggestion.
And I love, Janelle, I love your question, because you are working directly with parents and with families, and you're actively, sort of referring and trying to figure out ways to link families to these different opportunities. I think it's great. I love this. And this is exactly the kinds of conversations we wanted to have today, because because there's a lot of different money coming down the pipeline, right? A lot, and it all has different eligibility criteria. And it's like and the the great sort of opportunity here with some of these state funds is that they're adding in this category of prevention, right? Where we can sort of make a little bit of a easier sort of threshold or a lower threshold for eligibility, right? And make it as easily accessible as possible for children and families to access this, these housing supports. And so I think that is exactly the types of conversations that we want to open up to the larger group, sort of outside of the world of the administrator of these funds, is like, how can we make sure that families can easily access things? Like, how do we make sure that folks like Janelle know how to access these funds and know who's eligible, and really easily, like, put people on this, pathway, right? That I think is exactly what we want to talk about with all of you in this sector, is like, what is the best positioning of the state and of the operators, the administrators of these dollars at the local level within the larger, sort of county system, or within the larger like community system that is working with families and children. So that's great. Thank you for that question. I love that.
I had a question, Althea, just about, how can we, I'm just thinking how counties can help support families in getting actual housing, like they get the funds. But I know that working home that is safe, that is accessible to them, sometimes they'll look and there's a lot of, unfortunately, there may be a lot of landlords that don't accept, the housing funding because of just the stigma attached to folks that receive the funding. So I'm just wondering, are there any efforts around that? Or do you have any suggestions for some of our folks that are working with families?
Yeah, definitely. Oh, yeah, that sounds great. Please.
There are lots of efforts within each community, right? Because there's so much funding, right? So this is like one stream of funding coming through the Department of Social Services at the county level, right? But as Althea mentioned, there's a larger homeless services universe that, sort of includes the county, right? And some of these funds. And so we have federal dollars coming through, we have state dollars coming through, there's some local initiatives that are happening in each community. And what we've been working with communities on is, we understand there is a very limited vacancy rate within communities, right? Like the housing market is tight. It gets even tighter when you have, like Sarah said earlier, in Butte County, these wildfires, right? It gets tighter when you have, primarily tourist economy in a community, and there's a lot of Airbnbs, there's a lot of VRBO, there's not a lot of, more long-term rentals available. So we're trying to work with communities to really think about, like, what you're offering now with all of the funding coming down, is that you are offering people that are landlords, whether they be, small sort of mom and pop type of landlords with one property or two properties, to larger sort of corporate type of property owners, right? What we're saying is, we have guaranteed rent for you, right? We are offering, it's not a please help us, right? It's a, hey, we are offering you guaranteed rent. We're offering you case management supports. We're offering you all of these supports for your tenants, which you're always, no matter who it is, you're going to struggle with turnover in your units, right? But by having all these wraparound supports, that actually means that people stay housed, and you're going to have less turnover in your units. You're going to have less problems to deal with, because you have a team of people that are sitting behind that person that is, accessing our services. So what we're trying to get folks is kind of shift the paradigm, develop a system-wide landlord engagement process that really invites landlords in to participate with us and to take advantage of what we're offering, which is a lot of security for them. We'll even upfit their units, right? Like, they need some repairs done to their units. We can upfit them. We can put deposits, we can put holds, we can do all kinds of things that really help entice them into working with us. So there's a lot going on around that in various communities. And we'll be doing a lot more of that in the upcoming years as well. And I think you're frozen.
Yeah, that's great. Because I think, just, oh,
You're good now. You're good now.
okay. Yeah, it just, I just see the challenges, especially when you have like more urban areas, like, in LA, parts of LA where, it's like trying to even find a place that's so impacted with folks. It can be so challenging, and especially if you have, families that have been sharing housing, and then get this, and then they're not able to always have like all of the family members that they've been living with. It can be challenging. So I'm glad to see there's some work being done around that. So yeah, thank you.
And we're continuing to build housing as well, right? That takes longer, and it's a lot those are longer term investments. But we are continuing to build. One of the strategies on the ground is converting the Project Room Key motels that were used for non-congregate shelter into home key sites, right? So that means they're converting them into permanent housing units. So we're trying to increase the housing stock through rehab or actual construction, and like accessing what is available in the rental market. So there's like kind of multiple strategies all happening at once, but it's a big primary concern for everybody. Big urban area or small rural communities struggle just as much, if not even more, with with having enough available housing stock, even, for everyone in their community. What other questions do we have? Great question, Lydia.
My question's more on kind of the macro level. I'm less, I do advocacy at Children's Bureau, so I'm just kind of curious. I guess we hear of all the different kind of programs that are coming down, money for homelessness, for childcare, for community schools, for all kinds of different, getting heading towards universal transitional kindergarten. There's so much great going on, but then you have to think of it in the context of, okay, but that's set against the pandemic, and how far kind of, we're from where we started before the pandemic, how far we went back to then how far we're going forward. Are we overall seeing improvement? Are we thinking this is a good starting point to kind of actually improve things, or is it just barely trying to make up lost ground? I'm just kind of curious where what your thoughts are on what you're seeing generally among prevention and services like that.
Go ahead, Althea. I'll let you answer it first if you have some thoughts about that.
I don't actually feel like I have very well-formed thoughts. I think that's a great question, and one that, we're all meditating on. Prevention services, since they're so new, we haven't really been able to see necessarily those in action for our Children and Families program. But I will say that, I think in the other programs where we have prevention, I think, the preventative services were really, really crucial, but in, COVID, of course, highlights where there's like a lot of system dysfunction. And so, I could certainly talk about the ways where, the eviction moratorium and prevention services, like really were able to, stabilize, individuals who were at risk of homelessness. But one of the things that sticks out most to me is that like a lot of our systems are overloaded with so many people who need services. And, we see a lot that, for our programs, especially if, the person needs to move to new housing, that for the programs to really, really be effective, and, for housing stabilization to like really work at a systems level, there needs to be there needs to be sustainable, like long-term, either like rental subsidies or ability for people to make, have an income that covers their costs. And so a lot of times what we see, like with COVID, when so many systems kind of come to a standstill, is that like, we need all the pieces to be working together. So I don't know, that's kind of like one of my lessons learned from the year and a half, and like perhaps a lesson I already knew, but seeing it in action, like how much we all depend on these systems to work together for any of them to really work at all, is one of my takeaways. So that was my first thought. I don't know, Elena, what your takeaways are.
I think the thing that it really highlighted for us is not that we didn't know this before, right? Because we all knew it, but the eviction moratorium in some ways just highlighted the lack of actual housing that we do have in our communities. Because what it showed us is that we were relying on people getting evicted to be able to backfill those units with people, right? So it was like when everybody, when there was an eviction moratorium there, it just like grinded to a halt, like the availability of units on the open market. And I think that it suddenly made it very clear to us, like how much we just lack affordable housing in our communities all throughout. I think another interesting thing is that because people went to a work remote type of setting, what you had is people moving out of urban areas that were super impacted into smaller communities in California where, it's beautiful. They wanted to, like, if they're going to work from home, they might as well be in a beautiful place. But that also, like that migration of people out of the city into like the more rural areas, I think also just highlighted, it sort of very much impacted smaller communities and their housing market. So just thinking about how, like Althea is saying, all of these systems need to, it's like you see the effect of one on the other, right? And that's when you really understand we're in one ecosystem, right? And that we're not in separate silos and we all actually impact one another. So how can we better align our ecosystem to work together versus like constantly working at odds or, kind of in our own separate corners, because that's not actually how things are, right? We're all one. So I think that's what stood
Especially
out.
not how it is to the person experiencing it. They're dealing with all that stuff, not just you.
All the time, right? Exactly. Right. Yes, absolutely. And so we need to do our work on our side to make sure that their experience is seamless, right? Because otherwise it's like, it's just chaos, right? So I think that's sort of what brought us to this conversation as all these resources started coming down the pipeline, is how can we better align our systems for the people that actually have to navigate them, right? How can we make them work better? How can we make sure Janelle and her team know how to access these resources and can navigate somebody there without hitting a brick wall every time they try to get somebody down a certain pathway to get housing supports, when we could have. So, perfect example is the best method here is to prevent, like we've got to prevent people from losing their housing because there is no housing on the other side, right? Or I should say very little. So our best, one of our best strategies is to make sure people don't fall out of housing. But oftentimes it's such a system to navigate to get access to rental assistance before you actually get kicked out, right, of your housing, that like we have a hard time preventing. And so how do we ensure that each of the systems that is touching people knows how to get access to these things quickly? Or how do we bring the resources to the places where people already are so that it's quicker and we can actually prevent things from happening versus like letting them fall all the way down the rabbit hole and then try to get help when it's like going to be much harder and much more expensive for everybody to get them rehoused, right? So that's one of the questions that I had for all of you that are here with us today, is how can we, it's like very general, broad question, like how can we do this better, right? Like how can we make sure that our systems at the local level are talking to one another so that we that we're really leveraging this funding, that we're really spending it down, that we're really taking advantage of it and building up our communities and ensuring that our children and families are safe and that they are thriving. And just wanted to hear some thoughts. I know, Sarah, you were on the call last week. You said that your county's already kind of in conversation about how to leverage some of these dollars together. I wanted to hear from you to hear what's happening out on the ground. Like, are you talking about this? If so, what are you planning? I think we would all love to hear from you. Like, what's going on the ground? We're a quiet group today.
Can you ask that question again? I'm sorry, I'm not sure.
Sure. Yeah, like how can we make our systems work better together? Like, where are we already talking about, some of these things within your community? Janelle, you're in a nonprofit organization, correct? Yeah. So like, are you guys talking about some of these funding streams that are coming down to your local governments? And how are you sitting at the table kind of deciding sort of the best use of these funds? Like, how are we going to implement these things? How are we going to make sure that this funding gets easily accessed by your parents and the folks that you work with?
I feel like, personally for myself, I feel like there's a lack of a connection between myself and, say, homeless services, or the organization where I can gain more knowledge, understand eligibility, understand what's out there. Because like you said, we all know everything changes day by day, month by month. We're getting new stuff is done, funds are over. So it's really vital to have like a personal connection where that is discussed more frequently. And I feel like that's where a lot of roadblocks happen for me in order to help the families I serve, because you think you have it, and then by the time you know it, it's over and something else is new. And I'm, scrambling to try to figure it out. Actually, I just reached out to somebody in my community to say, hey, let me go and talk to you in your office. Like, I want to learn, what it is, all of it. Like, so that way, who to send to these programs, because practically every family that I work with is struggling with housing.
And I'm sorry, can I just speak a little bit to that? I think the other thing, especially if we are doing work that's more on a policy level or something like that, is how can we make sure that everyone in the system gets the information that they need, not just the information they need to do their job, but to really fully understand the program. And I think that is something that happens. And I think it really connects to equity is, how do we make sure that this information is for everyone, not just the people who think it needs to be for certain folks. And, when we do these things, this is like a parallel process. So when we have people that are kind of what we call gatekeeping information, like, I'm just going to tell you the little bit you need in order to do your job, you're kind of, not really including them in the process and what's happening. And so I think it's just something, if we have the ability to influence the folks that are making these policies within your county, or if you can give feedback, it's that how can we everyone understands that connection. What is this policies here? What is that connection to the work that I'm doing? And I think that not only makes you more informed, right, as an advocate for the parents that you're working with, but then you will be able to share that information with the families, and they'll be able to be more informed and be their own advocates as well. So we really want to, I think, see that modeling of that inclusive behavior happening. I hope that makes sense.
Yeah, Lydia, I think it does. And I think it's that's our constant struggle within our systems, right? Is like how to make the system visible to itself, right? To everybody that exists within the system, right? Not just the people that sort of, manage, service delivery portions of it, right? But to everybody. I'm curious to see, like, from some of the other communities that are here. Rachel, I think you're with Riverside, and Sarah with Butte. Like, what's happening in your community to like make things a little bit more, make information more available to one another within your community?
Can you guys hear me?
Yeah.
Oh, okay, sorry. So we actually, well, within the last couple of years, I was going to say recently, but it's been a little while, we implemented like a public awareness team that really is kind of like the liaison between the department and the community and the media and other outlets for getting information out to the public. And so we've really created a fairly robust, excuse me, a robust, website for people to access. We're also, because obviously a website would require internet access, right? And so when we're talking about homelessness, internet access can be a huge barrier because that's how a lot of folks even find resources, right? If I need a cleaning person, I'm going to go online maybe, so when people don't have that, how do you even know who to call or where to go? And so we're even doing things as kind of basic as billboards with, the 211 number that you can call, and you can, get information, from the county as far as, where to or how to access resources. We've actually got, folks who are basically like boots on the ground out in the community, literally, like handing out flyers and things, just trying to make those connections and trying to get the information out there so that, if there is a, family or a member of the community in need, the information, at least, how to access information is a little more accessible. So, and we're really trying to work with our community-based organizations also, because a lot of times, it's not, folks aren't necessarily even aware of going to a CalWorks office or that type of thing, but they do know where their local church is or their local food bank, that kind of thing. And so working with those community-based organizations to ensure that, the information that folks need is available there on site. So when I go to try and get food for my family or try to find, what resources the church might, have for housing for the night or whatever it might be, at that same time, I can be provided, with ways to, or the information, to get linked to resources. So we're trying to be a little more active and insert ourselves into the community rather than hoping the community can somehow find us.
Mm-hmm.
So that's, it's actually, sorry, for whatever reason, my voice is not working today, but it's actually pretty exciting to see, some of that community outreach happening. And we've also got social workers who are, going out into the field in an effort to be preventative. So before we have to, before your family is in such crisis that, court intervention is necessary, where are your unmet needs? What is it that you don't have or can't access, or that has been taken away from you that is putting you at risk of us having to intervene and provide support? And that as well. And we're going into those urban areas where, that is going to be, a more significant issue, just, a lot of times because of socioeconomic, stressors. So that's kind of what we're doing right now, which is probably very similar to what everyone is doing. That's not anything that's like some amazing out of the box idea, but, we're trying to make strides to make those connections and also to alleviate some of the stigma that comes with court involvement, because, sometimes, homelessness, especially right now, I don't want to say post-pandemic, that's awfully positive, but in the midst of we're seeing homelessness as a huge contributing factor. And so, but families are often embarrassed to ask for help. Like, even if they know where to go, they don't want to have to ask. And we all like to think of ourselves as being self-sufficient. So trying to reduce some of that stigma and say, hey, you're being a good parent by saying I need help.
Mm-hmm.
Needing help doesn't make you a bad parent. Ignoring the hand that's trying to help you, that's not what's in the best interest of your kids, or your family. But reaching out and asking for help is you being a good parent, being a good, caregiver, provider. So trying to kind of eliminate some of the stigma that has, I think, been a barrier for people, who are proud of their families and are embarrassed to, reach out. So anyway.
Thank you. That's great, Rachel. Janelle, did you want to respond to that?
Kind of. Exactly what I heard her say, there's a newsletter, there's a website, this type of information is exactly what I'm looking for. I know that Lydia did invite me to sign up for a newsletter. She's going to help me do that again. She said she's going to help me because I don't know why it would not let me. Literally, I put in all this information it asked me for, which was super simple, like my name and county, and it would just say no. But anyways, a website. I want to say I heard you, Althea, mention a website. Is that kind of the way Rachel described it is what I can find on your guys' website? Or do you guys have that type of information for Ventura County?
So I'll give you the website. I think I wish I could say that yes, that's what that is, but no, it's a little more specific to just our programs. But I think, and especially, well, I necessarily can't necessarily speak to Ventura County, but I think at the local level, that's also what we're trying to encourage, to think like a little bit about how, not only who needs to get the information, what information, but also how. So I'll do some digging around for Ventura and see if I have access to that. I'll put it in our CDSS website, but it's a little bit more like focused on our programs as opposed to like a housing and homelessness resource roundup. Although I think there are some other, I know of some statewide resources, but I don't think I really know local.
I know that
Ventura, at least.
I don't know how I got onto this newsletter, but basically it's from like the Human Services Agency, which is probably where you would go to get CalWorks and Medi-Cal and stuff like that. I get a email every single month from them that says, oh, hey, we're doing a turkey giveaway, or, these resources that are available for that month. And I used to never read them until I realized what they were. And I'm like, hey, this is really beneficial. I can share this news with the families that I serve, if not for myself, right? I'm not sure if that newsletter is kind of what that looks like, but that's a really good idea. I know that ever since I found out that's what it looks like, I make sure to read that email every single month because it tells you what's going on for the month.
And Janelle, I just posted your Continuum of Care, which is your main body to address homelessness. I posted it in the chat. I'm sure you probably have that, but just in case you don't, that's sort of the main coordinating body around homelessness within your community. The county is a part of that. And the CDSS funds that we're talking about should be also known to this governing body, right? But that's not always the case. It's sort of like community by community how integrated these things are, but they should be working in parallel to one another. So that's also a good website for you to get information from about what's going on.
I really appreciate that. I wrote that down, and I'll. Yeah.
Absolutely. And to sort of back to Rachel, I wanted to ask you, are you in Child Services Division within Riverside County?
Yes.
Okay. Which really, I think, even a year ago, we were sort of like talking about this, concept of really expanding your community outreach through PSAs and billboards and things like that. So it sounds like you guys have come a long way and like really launching that. So it's really exciting to hear. And I think we sometimes like counties really forget that, right? Communities really forget about the sort of making the system known and available to itself, right? Because they're just things are moving so fast, like especially now, funding streams are just coming down, you know, the ARPA funds to address like, you know, COVID inequities are coming down right now for every sector, right? It's like, it's almost like this overwhelm. It's like before it was, we have such limited resources. We're like, you know, really kind of, you know, fighting over the crumbs, but now it's like so many resources that we're overwhelmed, right? It's like the complete opposite. But I think things like that, just kind of going back to basics of like having conversations, like really making sure that the tables are, you know, that each table has everybody that it needs, that is, you know, sort of part of the system, including our parent leaders, right? To weigh in on how are we going to best administer, how are we going to best think about the intersections of our work, right? That if every parent and family that Janelle is working with is experiencing some issue with housing, then we have to make sure our housing folks are there at the conversation, right? And make sure they can tell you how to get to the resource. And or whether or not they can bring the resource to where you are, right? It's like that's one of the tenets of the work, is like meet people where they are, right? Like I would much rather that a family access housing resources from a family resource center or from within a school where they already go every day versus having to go into the homeless system, right? Like it's not optimal, right? It's like I worked on Skid Row for years in LA, and like that was always the worst thing for me, is to see young babies out there and to see, you know, families out, you know, and I would much rather that they were able to access things where they were, where they didn't necessarily need to come to Skid Row to access housing resources, right? So just trying to think about where, you know, what are the natural touch points for families, right? How do we partner in those spaces versus, you know, forcing a family to navigate over here, right? In a whole different universe, a whole different space that's unfamiliar. And I don't know to what extent, you know, some of you are already doing that. Did we lose Sarah? I think we lost Sarah. I was going to ask Sarah about Butte County, about what's going on there. But, you know, Rachel, you might be able to speak to that as well. Like, I know, you know, Riverside's doing a lot of housing work, right? You're doing a lot of work with your family resource centers and redesigning your family resource centers and making sure that you're doing community-based prevention work from the CSD side. Like, what does it look like, Rachel, from your side? Have you been involved in any of the conversations with like the housing people, kind of talking about where and how do you locate services for families?
So honestly, I haven't been in direct communication with them. I am, excuse me, I'm lead for our department on FFPSA, particularly Part 1, but my manager and I have also gotten very heavily involved in Part 4. So just in those, in that work and within those conversations, you know, there's a lot of, obviously a lot of discussion about preventative, you know, prevention, you know, homelessness, or I should say housing, you know, being a very significant factor. And so, although I haven't, you know, worked directly with, you know, with the resources, you know, for housing and housing assistance, it's something that is frequently discussed. I also am the department's wraparound liaison. And so in working with our provider, there is a lot of connection to resources as well, just because, again, you know, we've said it a million times, but, you know, housing is such a factor for families, you know, in terms of stability. You know, you lose your housing, you know, and that just can spiral downward. Because then you lose your job, and then, you know, you maybe revert back to patterns or behaviors that, were not beneficial for your family in the past, and you've overcome those things, but then in the face of all this adversity, it's easy to go backwards. So anyhow, that didn't answer anyone's question. I'm sorry. I was just trying to think if I've had any actual, direct interaction. But I would say more so through being the wraparound liaison that I've just, I have seen amazing work being done. We have a very, very resourceful provider, and they have an excellent resource team that is constantly building up the pool of resources for families. So I'm always just really amazed when I send a referral to the provider for a family to start receiving RAP. And, I mentioned, hey, housing, they're in a housing crisis right now. We need to do something. And within days, sometimes they're like, okay, we got this covered. We got, we found a place, it's blah, blah, blah. And I'm always like, how did you guys do that? It's pretty miraculous sometimes. But other than, I guess, being like the, watching from the sidelines, I haven't had direct interaction, but it is always encouraging to hear those stories, because it reminds me that there are resources out there. And it's just a matter sometimes of getting the information, putting the information in places where it's accessible to people who are in need of it. Like I said before, if you're going through a crisis like that, you may not have internet, you may not have a device, through which to use the internet, you may not have a vehicle or a way to get to a library that has the internet, all these things that like we take for granted that, how does a family, how do you do that? How do I even get on the bus to get to the library if I don't have any money or don't know how to ride the bus? So there's just, anyway, but that's where I'll digress, but I'm a huge supporter, a huge advocate of RAP, because it really does help families get connected to those resources and help them find their independence. But housing is a huge part of that. So I guess this is a reminder that I need to maybe be a little more involved or get a little more involved with that.
Well, Rachel, I appreciate that. And I think, I work in Riverside County a lot. So I tend to know a little bit about, the what's happening sort of on the ground in Riverside County. And you have a huge, massive territory that is Riverside County, right? It's a ginormous territory, not as big as San Bernardino, but it's big in terms of square miles. And, what I would love to, because I've been sort of toying with this in my mind, really really figuring out the care pathways and partnerships between, Child Services Division, your family resource centers that are now operated by First Five, and your homeless service support systems within the community. And how can we make those work together a little bit more seamlessly? And, not necessarily co-location, but I know you have a lot of families coming into the family resource centers through, the 5 county operated ones right now, at least, that are requesting, housing support help. And so how do we make that a little bit more available, on site to families as they try to navigate across a, big sort of just landmass of that's Riverside County, right?
Yeah. And that, and that is part of our struggle. Even though, LA County is, obviously much bigger, in population, but, our geographical challenges are extremely difficult. We go all the way to the, the Arizona border, and we're very wide. There's a lot of expansive, area in there that is just kind of desolate. Families can be very, very isolated, and again, even finding a family resource center to go and, where a family can go and access help. How to, well, if I'm out in Mecca or Blythe, how am I doing that? So those are some of the challenges, of I would say a more geographically sprawling, county. But we are seeing, through our probation department and through behavioral health, or as many counties refer to it, mental health. But they are doing quite a bit of expansion out in the desert areas, which are, those are I would say the least densely populated and the most kind of spread out areas. And, a lot of families end up in those areas because they weren't able to survive economically in more densely populated metropolitan areas. So they end up kind of in the outskirts, but then you're very, very isolated. You have no family supports, no, a lot of times they've left everything behind, and, now they're very isolated. So I know that all three of our departments and many of our providers are actively trying to expand resources in those more remote areas. So hopefully that'll help kind of bridge the gap, actual physical gap that we do see families struggling with. So, but yeah, that's another. I mean, every county is unique, and every county has its own unique challenges, just like every community does. But overall, that is a big factor for us. Even our social workers, when you have a case, you have a family that's located 3 hours away from your office, or, even more so maybe now that we're all teleworking, that in and of itself can be a challenge. But I'm sure that that's also an issue for a lot of other counties.
Yeah. Well, thank you. We're at time now, so we'll let everybody go. But I'm really glad that you joined us. I'm really hoping this is the beginning of many, many conversations that you're going to have in your communities about braiding all of this funding coming down. Please reach out to us in the interim if you want some help thinking that through. We're always available to you. And yeah, thank you very much.
Great. Excuse me. Thank you, Elena and Althea, for joining us again today. So we truly do appreciate your time and just the opportunity to ask some further questions about the housing initiatives that are coming down. And I think it's so important to just really educate ourselves on, what are these programs all about? Who might be eligible? How might they intersect in the work that we're all doing with our communities? So we do appreciate that. So as we continue our series on aligning funding and initiatives in California, our next series is community schools funding with the United Way and the Children's Defense Fund. So we are fortunate to have Jose Vargas from the United Way and Janice Connellan, who's the Senior Health Policy Associate from the Children's Defense Fund, talk about how community schools funding will be administered in this upcoming year and how it might connect to the prevention work that many of you are doing. We will also have a learning exchange session that will accompany that on December 7th. And when we do the follow-up, because usually what we'll do is just a follow-up email to send you the link to this session, we will include a flyer for this. So that will be included. And then it's also on our website under the events list. So you can also register that way as well. And if you wouldn't mind, if you had a chance to click on the survey link, we have a SurveyMonkey link that just lets us know how the session went, what were the highlights for you, how we can improve for our next session. So please feel free to do that. If you're not able to do it now because you're on your phone or something like that, we will also send that in the follow-up email as well. So you'll have access to that. So that survey link is in the chat. And again, I know we say this often, but if you could stay connected to us, we have a Facebook page under Strategies Technical Assistance or Strategies TA. We have a LinkedIn. We also have a YouTube. So all of the events that we hold, we put the recordings on our YouTube channel. So if you weren't able to watch the original webinar from Elena and Althea, you should be able to see it on there. It's posted on our YouTube channel. And then as always, you can always find out more information about the work we're doing and the events we're holding on our website, and you can sign up on for our newsletter. Janelle, I made sure you were signed up, so hopefully you should start getting our emails. Yeah, so thank you again for your time, everyone. We know you're all so busy with the families and communities, and we are so fortunate to have you all here to share your experiences and your expertise on your communities. So thank you so much, and we will hopefully see you at our next event. Have a great afternoon.